11:05 and right back at it. Dr. Payne is here. Dr. Lou in the house, and it is going to be Pinpoint Health moving forward very shortly. You are doing some big things, brother.
Yes, sir.
It's going to be awesome clinics-wise, too, not just the radio show. So tell me about it.
Yeah, so I mean, the whole purpose of this was, number one, to start educating the general public on the right way to deal with pain and injury,
right.
and manage it the right way. Because unfortunately, and that was a big motivating factor for me, was that being in practice and seeing the things that I was seeing, it's sad. I can't think of a better word to describe it. It's just sad on both the part of the types of clinics that exist, patients not doing what they're supposed to,
mm-hmm.
And just seeing what the eventual end stage of things like chronic injuries and chronic pain can be. And so I thought this public platform of education would be a very important thing, so that at the very least the people who are listening are learning and understanding, which is important. One of the things that is consistently apparent in all of the studies around pain management is that education and empowerment definitely help the prognosis. So that's number one. When we first started, I have a provider network of people
right.
That I trust. But as time has gone on, I mean, the only way really for people to get, because there were times that I sent people for certain things and to a provider that I may have trusted, and then it sort of goes astray because you can't oversee, you can't do those things. So the whole point is that we want to be able to provide, like Greg actually usually says, a safe environment for these things, a safe environment for your injuries, for your pain management, the right places to get the chiropractic, the physiotherapy, the massage therapy, osteopathy, anything related to the paramedical services. And we want to provide a place that the public can trust, that you can have that trust because the accountability of what I'm doing, and I'm overseeing these locations. And so we're at 5 locations right now and growing. We still have our provider network, so, not to worry if there's not a location near you. There's still someone that can help you. Having said that, sometimes I've seen people now that we're at, 5 locations and growing, and I think we'll have another 2 or 3 by the end of this year, is people are sort of like, well, I was speaking to someone that saw me at the Etobicoke office, and I suggested that they should get their care. And, the one thing that I just want to make clear, when I suggest that type of care, I'm very honest with people. I tell them, you can go wherever you want. So the rules around this are this is not just me being an ethical person. It's also, I'm bound by my professional regulations as a healthcare professional. Yeah. And people are allowed to go wherever they want. So even if you see me and I've recommended that you need physiotherapy, for example, that doesn't mean you need to get the physiotherapy from my location or from the people that work with me. You can go anywhere. And I tell people this all the time. I say, here's where obviously I've built a practice that can help you, but if this is not convenient or you prefer not to come here, whatever the reason is, there's lots of choice. You do the research. Sure. I tell them the red flags to look for. I suggest the things that are probably better things to look for, but it's always up to them. But I remember someone, I was seeing them at the Etobicoke office, which is at Etobicoke General Hospital, Highway 27 and Humber College Boulevard, and I had suggested rehab, and they were like, well, is there anywhere close to home for me? And I said, well, where do you live? And they said Islington and Steeles, I believe it was. I was like, well,
yeah, I just gave it to you.
Yeah, it's
pretty close
right here. And they're like, oh, nothing closer. And it's like, well, there has to be a certain...
Would you like me to move into your basement?
Well, I actually made a joke. I said, well, I could open up next door. And
middle of the night? How you feeling, man? You okay?
So I mean, it might be worth a 15, that distance is only like, 7 or 8 minutes, but to get the right type of care might be worth, a 20-minute, 25-minute drive.
Sure.
Because a lot of the times what we're doing and the treatment plans that I'm recommending, this is not, 2 times a week for the rest of your life. This is typically rehabilitation, go home, do a lot of this stuff on your own, come back in a few weeks, let's see where you're at, let's build on it. And so it's not something that, you need to be in there 5 times a week, which there are some injuries and things that happen that you might have to be there.
To start, maybe.
Yeah, at the start. Or if someone threw out their back really bad and it's like a disc herniation or something like that, those types of people you typically have to see every other day to get better. But that's just, we follow what the protocol is for the injury and what the evidence is. So the whole point of what we're doing, again, is to serve you better so that you feel like you have a place that's safe to go to, that you know you're going to get the care that you need. There's not going to be any of this shady stuff that goes on in a lot of these places, unfortunately. And we're not there for that either, because the reality is when we talk about shady places, there's also shady people, right? That come in, and, you know, I've seen it a million times. People come in and say, you know, my benefits have this. Can we just max it out? And we sort of we'll
divvy it up.
Yeah, we can divvy up the money, and it's like, no, like this is that is, if that's what you're looking for, we are not the right place for you. If you've been hurt in a car accident, even this, people hurt in car accidents, and they know there's an inherent value to someone being hurt in a car accident for rehab in Ontario, and people saying, well, we'll just sign the log that we came in, but we split the money. We're not interested in that. If you're interested in getting good care, great care, from an incredible team of healthcare practitioners, which, again, the other unique thing about this team is the different amounts of professionals that are involved. So even if you're seeing a physiotherapist, but they think you need to see an orthopedic surgeon, that can happen for you, which is not something that's very common. Or if you're seeing a chiropractor and they think you might need to see a physiatrist for an injection, that can happen. That is the quality of care and the standard of care, the multidisciplinary approach that we're building. And so it's I think it's very exciting. I think it's an important thing, and I think the people that are taking advantage of it are already reaping the benefits of it.
Good opening call, pal. We'll take a short break. The phone lines, by the way, have questions about your pain or your health. Bring them on. That's why we're here till 12. 416-870-6400, star 640 on sale. Dr. Payne Show just getting warmed up right here on Global News Radio. It is 11:15 indeed. Give us a call if you have concerns about your health. Wanted to ask something, this is the time to do it. 416-870-6400, star 640 on your cell, brother.
One of the things that before we went to break there, so not only do we have an incredible list of practitioners that service the patients that we see, but our clinics also provide a lot of other things, like, for example, things like custom knee braces for anybody that has any type of injury or any type of bracing. We do all different types of bracing. So assistive devices are definitely part of injury and pain management. So that includes braces, sleeves, compression stockings, orthotics, and all of those things that are often required. And again, a lot of clinics out there are just simply using these things as, you know, you have coverage for it, so let's give you one. Whereas we're actually putting a lot of effort in when we make these products for someone. We're making them with the true intention that we're trying to achieve something. Yeah. We don't just make an orthotic to make an orthotic. It's because there's an inherent benefit to it. Or if they're going to be using compression stockings, there's an inherent benefit, or a brace, or some type of sleeve, or whatever. Anything that's required is really there, and we have a lot of those products available. Some of the other specialized programs that I want to mention that we've really seen some great success with. So a lot of our practitioners are being trained in concussion management. So there's a lot of new programs out there that are coming out with the latest evidence-based protocols to concussion. And our practitioners are being trained so that they're up to date in that. Vestibular rehabilitation. So things like dizziness and vertigo that's chronic, that, you've ruled out the more serious things, and it's really about
inner ear stuff,
inner ear and neck muscles and things like that, which is vestibular rehabilitation. We're doing a lot of that stuff too. Pelvic health stuff with our physiotherapists. Any type of pelvic issues that, again, have been deemed to not be something more serious, that have deemed to be musculoskeletal, well, you need to get the right care for those things. And so these are some interesting things. And again, specifically the concussion and the vestibular rehabilitation, the practitioners that are being trained in it and the people that we're seeing, just incredible results. And I, again, it makes me very proud to say that. And it also, I think it's a great thing. And if you're dealing with those things, the longer you wait, the worse it's going to get. So deal with it sooner.
416-870-6400, star 640 on cell to call in now during this show up till 12 o'clock. Have you, based on on what you just mentioned about concussion, have you noticed an increase in that lately since you started practicing? Is it going up with kids especially?
I think there's an increased awareness.
Right. So
it's more, I think it's coming in a lot more because I think the general public is also more aware of it. Whereas, before, when you and I were young, if we dinged our head, riding a bike, it was just sort of like, oh, go lay down, and then that was it, right? right? Whereas as now, if something happens right away, there's a big worry around concussion. So I think there's more awareness about it. I don't think it's necessarily happening more often. If anything, there's probably better management around minimizing it happening. But I think it's definitely, there's a lot more awareness, which is good. That's a good thing. That's not a negative. We want more awareness around it. And if you're worried about your children, especially that are in sports and things like that, and concussion, it's always good to get even baseline testing. So that baseline testing being when you're testing someone prior to a concussion. So hopefully it never happens, but having a baseline as to what their cognitive abilities are and the way they're functioning is very, very important.
Get to a phone call. That is why we are here. Tom, thanks for hanging on. How are you?
Good, I guess.
Okay.
The problem is when I'm sitting at home and I'm relaxing after a day, and I can actually feel my shoulder clunking or joint movement.
Okay.
But there's really kind of no pain.
What does really kind of no pain mean? Is there pain or no pain?
There's a light pain, but it's nothing that I can concerned about unless I'm sleeping and I kind of move my shoulder quickly.
How long has this been going on?
A year or so.
Okay. And what type of work do you do? Is it
automotive?
Automotive. So
you're using the worst one. Yeah.
Okay. I mean, and this has never happened before, the clunking, the popping, and those things.
No, not really. It's been pretty good to me.
Yeah. Okay. So there's. It's very hard to say, but I mean, anything like that. You're in automotive, so it sounds like, are you a mechanic?
Yeah.
Yeah. So, if someone brings in their car and says everything's working well, but there's some clunking and some popping that's happening, you're going to say the same thing. I'm going to have to look at it and see. You might have some ideas as to what's going on. Wear and tear happens. And that's sort of what this sounds like, is that there's a lot of wear and tear. Those types of symptoms are consistent with as joints wear and tear. And if there's excessive movement in them, in terms of, more serious things, like, have you had any dislocations?
I almost had one, but it seemed to, long time ago, I almost had a dislocation, but I pulled it and then it just kind of maybe automatically went back. But it was very painful then. That's when it was painful.
Right. Okay. So then, that starts.
It started.
Yeah, and that may be when it started. And a lot of times, so the issue with dislocations, or when someone thinks it went way too far and almost dislocated, is that the rotator cuff muscles get stretched beyond a certain amount that they'd want to be stretched, and that can create some inherent laxity that is then there for the long term, and that laxity is what causes that clunking and that popping. I mean, if we were to look at a skeleton and look at the arm and the shoulder blades, so the humerus and the scapula, really the only thing holding that thing in place is those muscular tendons. Otherwise, it's a free-floating joint. So, right. If it almost gets dislocated or something happens that stretches those over a little bit more than they'd want to be stretched, then it sort of makes sense that you could create clunking and popping. And so an important thing that you said is that there's minimal pain, but it's always important to get these things looked at. And you would appreciate this as a mechanic when it's a minimal issue versus when it becomes a big issue. So I'd encourage you to come see me and let's take a look at it.
Yeah, well, I can't go see my doctor because he tried to kill me.
Wow. Okay, then move on to Luigi.
That story.
yeah, for sure. You want to reach out, Tom, for sure. 1-855-55 Lou, DRLOU. Email is info@PainCareCanada. And for you, still got lots of time to call in. Don't waste the last 5 minutes of the show because then you run out of time. 416-870-6400 star 640 on cell. Dr. Payne Show, Global News Radio. 11:25 Saturday morning. Still lots of time for you to call in, ask your questions about your health. 416-870-6400 star 640 on cell. Ted, good morning.
Good morning.
What's happening with you?
Well, I'm actually working now, and I'm taking the call in the cab, so I'm going to try and make it quick. I recently had a saliva gland removed, and ever since that time, I've had constant pain and bad taste in my mouth.
Okay.
And so he's pretty well put it down to that they probably nicked the nerve,
mm-hmm.
and that there's basically nothing they can do. He's put me on medication. It's a narcotic of sorts. It's GABA something.
Gabapentin, probably.
Gabapentin, that is, yeah. And I'm on that, and it seems to help,
Mm-hmm.
But then if I don't go back. Every 8 hours I take a couple,
Right.
and it seems to help it subside.
Okay. So what's the question, Ted?
Is there any solution to that?
Oh, I don't. That is a very specialized area, and a neurosurgeon needs to comment on that. I don't. I mean, anytime there's nerve damage, once there's nerve damage, it's nerves don't regenerate. So, it's a tough one. But definitely, when we're dealing with inside the mouth, you're dealing with a specialized area of health, and I think I'm better to defer those questions to the people that you've already seen. And if they're saying that there's not much else, then I don't think I would have anything else to add.
Yeah, no, I just thought to give it a shot.
Yeah, no problem.
Yeah, no worries. No worries.
Anyhow,
Okay.
I better get on to my next job here.
I got you. Us as well. Thanks, Ted. Appreciate that. Still time for you. 416-870-6400 star 640 on cell. That's cool. You just looking for an answer, man.
Yeah, and there are some areas, like I know people with the pain, they think it's related to everything, but there are specialized areas. Like if you have eye pain, for example, I am not the guy to help you with your eyes.
An ophthalmologist.
No one in my team either. Things like this, we don't have dentists or oral surgeons or ENTs. Not our things. I get a lot of calls for gynecological pain issues. Same thing, not our area that we can help with. Now, you might have pelvic pain, going back to what we were talking about before the break, that's been ruled out to be any gynecological type of issue or organ issue, and it might be muscular related. Yeah. For sure, that we can help with. Even actually, I guess we should say, even in the mouth, you can get TMJ pain, which is more of a musculoskeletal pain inside the mouth, which again, we can definitely help with that. So, I think if we're dealing with some specialized areas of the body with some important, stuff there, like your eyes, your mouth, your heart, if it's been ruled out that it's not a cause of those more serious things, then definitely the team and myself can help with those things, and that's good. That's what you want to do. You want to rule out those more serious things, which is important, and it's good when those things are ruled out, and then get the MSK or the musculoskeletal treatment for the muscle joint issues.
It's funny too that you mentioned that before, the nerves don't rebuild, which, and I know you're not an evolutionary biologist, but it seems really weird with all the things that the body could repair. You think it's weird that evolution hasn't, because that's, people get paralyzed because the nerves don't rebuild.
It's probably because of how important it is and how long it would take, right? Like it's not, it's such a specialized area, right? And the communication behind it. So yeah, I'm not sure why the body hasn't
weak.
I know.
Figure it out, buddy.
Yeah.
Get on it. Phone calls. Got plenty of time for you. It's 11:29. It's 416-870-6400 star 640 on cell. This is the Dr. Payne Show on Global News Radio. 11:32 is where we are up until 12. You have time to call in with your phone calls, ask about your pain questions. I suggest you do so. It's a good place to start. It'll give you some contact otherwise to move on from that point. 416-870-6400 star 640 on cell. You are expanding the provider network. In fact, you're going to have control of these, which is the way to go. So Pinpoint Health is on the horizon, my friend.
Yes. And your complete list of services, paramedical and medical services that you can require. And depending on the location, they're all sort of different. Like our Brampton location also has walk-in and family practice, pharmacy. Up in Newmarket, we have physiatrists there. Etobicoke has orthopedic surgeons. So there's a lot of variability, and it's really designed, again, with a multidisciplinary approach so that somewhere in the team there's everyone that can help with pain management. So I think it's very, very exciting. It's a place that, the public can go to and sort of trust that name, trust Pinpoint Health, because, there's an accountability factor. As I've said before, I'm here on the radio. I want to hear, I'm always available anyways. I want to hear about the good, but I also really would want to hear about if there's any bad experiences. And again, I'm not just saying this, I haven't had any complaints. So, if they're out there, I'm happy to hear them, because I think it's important to, and oftentimes complaints are nothing more than misunderstandings, right?
Yes.
Like a lot of times it's just a matter of really sitting down with both parties and sort of saying, okay, like what happened here? And so I'm happy to hear those things, because we want everybody to be getting the care that they need and the experience that they need. And now that doesn't necessarily mean that, that we're guaranteeing that if you come in, you get 100% better. That's not what we're guaranteeing.
It's called management.
Yes, and also
Right.
it's the reality, and we make that clear with every single patient, because with everyone it could be different. Some people might have a chance at getting 100% better. Some people might only be looking at 20 or 30% improvement, but that's the conversation that we have in the beginning when we assess the individual. And it's really about figuring out, okay, so what's the best plan of management for this person? And we make that recommendation. And then again, there's the part that the patient has to do too. This isn't
about to say that.
Yeah, this isn't that easy. This isn't just like, here, do this. And I saw about 6 or 7 people this week who had done, like, musculoskeletal type injuries, mechanical in nature, nothing major, had done all of the past, like, the same people come in and they'll say, I've tried the chiro, I've tried physio, I've tried massage, I did acupuncture, I saw an osteopath. They've tried everything. And once I say, well, what are you doing on your own? Like, are you doing exercises? Are you eating properly? Oh, no, like, I haven't done any of that stuff. And it's like, well, that potentially is the most important stuff as after about 6 weeks of dealing with something. So, there is a part, and we're very honest with people. You have to do your part. And if you don't expect miracles. Right?
Mm-hmm.
Don't expect miracles. If
it's a team effort, you're part of the team.
Yes, 100%. We're just there to show you, right? And it's no different than anywhere else. I gave an analogy, and I think I said it on the radio too, but there's this sort of misconception with these things. But, I had a gentleman, same thing this week, was wearing a pair of glasses and was sort of saying, I've done that stuff and I'm no better. And it's like, but when you first went to get a pair of glasses for your vision, did they tell you that those glasses, you'd only have to wear them for 2 weeks and then you could stop wearing them or wear them haphazardly? No, that is part of your management for your eye issue. Well, this is the same thing. If you have an injury or pain issue, you have to have a chiropractor, a physiotherapist, a massage therapist, whomever it is, to be part of that team. And we have the full spectrum of those professionals that can help deal with that stuff.
We'll get to Robert. Hey, Robert, thanks for hanging on for a moment. How are you?
I'm fine, thank you very much.
Sure.
It's a pleasure to be able to talk with you, Dr. Lou.
Thank you.
We've been listening for quite some time.
Oh, that's awesome. Thank you.
And I need a issue weight-bearing brace for my right leg.
Okay.
And I'm just wondering how you handle the interface between top of the leg and the ischials, because they can be very uncomfortable.
And the ischials?
Yeah, issue tuberosities were the brace.
Oh, I see. Okay.
Do you know what I mean?
Yep. Yeah. Well, that's the whole component of being custom fitted for a lot of these things, right?
Custom fitted.
Yeah, and that's how you deal with that stuff, is really understanding the measurement and looking at somebody's body. And we have bracing specialists that do this work, but that's essentially what they're doing, is they're looking at this. And sometimes it's sort of like, if you're a dentist and you're giving someone a retainer, right? You're doing the best that you possibly can, but a lot of the times there's things you can't account for. Person might go wear that retainer for a period of time and come back and say, hey, it's really hurting on the inside of my gum here, and I can't wear this thing. Then they modify. Well, we can do the same thing, right? You can have...
I understand that, yes.
Yeah. And so that's really the only way to do it. There's no gold standard. Like, there's nothing that I can think of, like, on day one, can you get it 100% right 100% of the time? No,
I don't believe that.
I
tried having several of them made, and they, I just didn't work.
Right, yeah.
So it's very tricky trying to get that interface and getting it comfortable.
Yeah, do you still have the ones that you've had made?
They might be around here somewhere, yeah.
Yeah, so that's
one of them I took apart because I thought I could improve it, but I didn't, of course. I just ruined it.
Well, if you're interested in maybe looking at, like...
here for you get an idea of what he was doing.
Yeah, so I mean, an important thing too is if there's something that doesn't work, bringing that in as well, and we can look at it and sort of see why maybe it wasn't working, and see if there's modifications that can be made. But that it's sort of it's got to be trial and error with, like, even with orthotics, right? Like when we do orthotics for people, it's the same thing. That's
orthotics.
Yeah, exactly. It's about, like, we do our best to base it on what we're seeing in the office on the clinical exam that day, but it might not react as intended with a person, so we modify it, and a lot of our suppliers understand that, and so
it can be
we have
modification.
We have a window where we can make modifications for free, right? So that's an important thing versus, sometimes people will have something and they might want to come in 3 years later and say, this isn't,
you're out of warranty.
Yeah,
son.
you should have come back, 3 months later, not 3 years. So I think, but I'd be happy to look at what you have and see where we can go from there.
Okay, that would be wonderful.
Okay.
Thank you very much.
No problem.
Thank you, Robert, and appreciate you listening for so long. Continue to do so. To reach out, 1-855-55-Dr. Lou. Robert, that's DRLOU, info@paincarecanada.com. Your phone call, still some time to go here. Bring them on, 416-870-6400, star 640 on South. The Dr. Payne Show on a beautiful Saturday morning right here on Global News Radio. You still have time indeed. Pinpoint Health, that's what's coming. That's what's in the close horizon anyway with you guys. In the works, yeah?
Well, it's there. We're definitely, so all of the current clinics have it as provided by Pinpoint Health, but we're switching it over. So everything, when you're driving around, you'll see Pinpoint Health. And you'll know
nice.
that's my brand of clinics, and again, feel free to come in. And here's the other thing: you don't have to just see me. There's a big team. There's a lot of us, and feel free to go on the website, check it out, and see if a certain provider that you may want to see, and then just sort of give them a call, and you're in good hands with anybody in my team. That much I can assure everybody. The whole reason why I've put together this team is for that reason, so that I can be certain that when I'm recommending someone to someone, that I know that they're getting what it is that not only that I want them, but what I want is based on the evidence. It's not based on just because I want it. It's really based on. And the nice thing is we're bringing into play their clinical experience. The other thing is because our team is so vast, we can talk with other professionals about your case. If you're seeing a physiotherapist and they're sort of stuck on something and they need the orthopedic surgeon's opinion, they'll go do that.
Fresh set of eyes, right?
Yeah, it's sort of like a rounds about the patient, which I think is a great thing. And I've always encouraged people, like sometimes I'll refer someone to a chiropractor and I'll say, but see multiple chiropractors at that location, right, and see the one, because the other thing about this stuff is personalities, right? It's not even just about the care. Some personalities jive better with other personalities, totally. and that's an important thing to try to match up. And I do my best, because I do spend quite a bit of time with new patients, and I sort of get to know them to some small extent, but I can tell their personalities. And so if I make a referral to my team, I also not only try to base it on what they need, but I'll also try to think match them up. Like what person, and I might be wrong, because I only know that person for an hour, and but I think that's an important thing, that personalities need to match up as well.
Overall, with the Pinpoint Health thing, it's based on consistency, which is what you need, which is what, not that you were lacking, but you're going to be putting a finer point on it, because consistency across the board. I mean, hey, you pull into a McDonald's, you know what a quarter pounder is, and then it never worked for them. Yeah,
I always trusted the providers that I was referring to and still will continue to refer to, but I can't control it, right? I can't oversee, so I can't control like simple things like pricing or how soon somebody gets a phone. A lot of the issue wasn't really with
the care itself,
because I know that the care is good. Otherwise, they wouldn't be part of my provider network. But it may have been the timeline.
Periphery, right?
Yeah, like I've referred people to certain providers, and then those patients will call back and say, I've been waiting for 3 weeks to hear back from this person. And that to me is the type of stuff that's not acceptable, right? And those are the things that I really can't control, their administrative back end stuff, but definitely if it's part of my team, I can control that. And so we work a lot on efficiencies from that perspective. Just how quickly can we turn people, like get back to people, book their appointments, availability, convenience, et cetera, et cetera.
416-870-6400, star 640 on your cell. You have any questions about your health, you still have time to call in here. We're here till 12 o'clock today. As you know, 1-855-55-DRLOU, Dr. Lou, to call outside of the show hour.
A lot of the times we talk about the professionals, but and why don't we go through a bit of a list on the types of things
you bet.
That starting at the top. So any type of headache or head pain is something that we can absolutely help with. I mentioned a little bit earlier in the show, jaw pain, TMJ pain is something we can help with. Any type of neck injury or pain, so whether that's as simple as a muscular strain or all the way to a disc herniation, are again things we can help. Shoulder issues like torn tendons, or frozen shoulder, to name a few diagnoses. Then moving into the elbow, so obviously the golfers and tennis elbow type of stuff. Wrist issues like carpal tunnel, any stiffness in any joints, obviously upper back pain, lower back pain, and again, the spine-related pain, all the way from a simple muscular issue to a joint issue to a disc herniation to a combination of things. In the hip, osteoarthritis of the hips and knees, especially with the injections, the PRP injections, are things that we can any real injuries in that area, in functional issues in that area, right? When we're dealing with athletes who are doing things and things are just getting sore, all the way to ankle sprains. So they're pretty much anything. If you've got any ache or pain or injury in your body, someone in our team can help with it.
And we've had them on the show as well. You've got a wide berth when it comes to contacting surgeons, and that it's not just physical stuff, right?
And
Dr. Bragava, and
Dr. Bragava, Dr. Gordon, and with the knee stuff, that's been incredible. Just getting people in quickly when they need to. I usually will see these patients as an initial screen, and if I believe that they're a surgical candidate, they're going straight through. But you know what? Now we're sort of doing it with every body part. So if I see somebody and I think this is a surgical case, we get it screened right away, and we get them sent out. We had a person who had very severe osteoarthritis in the hips. And needed hip replacement. We sent it off. One of our surgeons was able to make some calls downtown at some other hospital, and this person's getting in I think it was like 6 weeks. It's
nice.
Yeah.
Wow.
So, yeah. So it's pretty quick. So anything like that is definitely something that we can help with. But it comes down to a matter of not. So a lot of times I will get a call where someone will say, I've got arthritis in my knees, and I want to see the surgeon. It's like, but how do you know you have arthritis? Oh, I just know. You can't self-diagnose.
No.
Right? You can't diagnose, and you can't do your own plan of management. So I hear this a lot too, like, I need an injection, or I need this. Well, how do you know you need that? Oh, well, because I was reading. Yeah, I was reading about it, or my friend's mom or someone did this and it worked for them. It's like, well, no, let me be that person. That's really my role in the organization, is let me be the person that determines what it is that you need, along with the conversation with you, of course, because I'm not going to recommend something that you don't want. But let me be that person that helps to figure that out from a medical perspective. Like, let's not just self-diagnose, self-plan management. Those are the wrong ways to go about it. So, don't, I always say to people, don't call with what you think you need, call with the problem you have, and I'll figure out, and I'll help you figure out what the right step is.
It's like a buzzing in your car. You're not going to start ripping it apart in the driveway. Get it diagnosed properly, right? 416-870-6400, star 640 on your cell. You still have some time. Pain questions about your pain, or for a friend or family member, regardless, doesn't matter. Bring it on. Dr. Payne Show, Global News Radio. 11:53, a few minutes to go. 416-870-6400, star 640 on cell. Dr. Payne Show. It's funny that Jody's playing an old Stones tune. There's a video just released that's going around of Mick Jagger. He's in a mirror and he's doing his Mick Jagger dance. Yeah. And he just had heart surgery. Yeah. And he's back up preparing to go out on stage. That speaks to what you always talk about taking care of yourself, man. Get on top of stuff. This guy's 76 or 75? Yeah. He's back dancing again, ready to go on tour.
Well, because he was also, he took care of himself prior. And it's funny you bring that up, because I was just going to talk about the prehabilitation, right? So seeing a lot of people, if you're scheduled to be going for surgery and you're not doing anything about it,
just waiting for it to happen,
you need to be doing something about it. I saw another patient this week who I recommended should have a knee replacement, but has a whole bunch of other things going on, and doesn't take care of himself, just diabetes, heart disease, you name it. And so I was talking to him, and anytime I'm like, what's your diet? Like, oh, it's pretty good. I hear that a lot. It's pretty good. Okay, what's your exercise? Like, it's not bad. I exercise once in a while. It's like, okay, well,
I'm saying you're 0 for 2 at this point.
Yeah. So what I said to him is, listen, about 2 months prior to your surgery, be perfect. Not pretty good. I know it's tough, but especially if you're going for surgery, be perfect. And there's don't mistake that. I'm not saying be 99%. No, you have to be 100% perfect before you're going for surgery. And if you're not doing a strengthening program or a rehab program or prehabilitation prior to surgery, you're doing yourself no favor whatsoever. The research is very clear on this. And even worse, it's crazy. Sometimes I meet people that had surgery and they don't get rehab after.
Wow.
And it's like, oh my God, not only, it's bad enough you didn't get anything before, but you're also not going to get anything after, and you expect the outcome of your surgery to be mad. And then these are the people that, years later saying, oh, it didn't work out the way it was, and that damn surgeon, and it's like, no, a lot of the times it's not the fault of the professional. It's also the fault of the population or the person that, again, going back to what we speak about a lot, is they don't want to do their part. And if you don't do your part prior to these things, then your outcomes are not favorable. They could be much more in your favor by doing the right things. And you gotta take it seriously, especially leading up to these things and following these things, and do the right things. And don't abuse it either. I saw a person this week who had a hip replacement a few years ago, was a very active guy, and really, once he got back, he really overdid it, to the point that this hip actually ended up developing an infection. And it took months and months to clear this infection and replace the hip. And so finally the conversation now was, you need to slow down. I know you want to do everything that you used to do, but sometimes it's also about knowing, know your role. If you've had this happen now, you need to slow down. These are mechanical parts after all. They're not meant to be abused either. And you can't, sometimes you have to limit those things, right? And sort of take it down a notch. But the important thing is, do you want to be able to do so much for just a short period of time, or a little bit for a longer period of time? Right. And that's the trade-off. And I equally see that. I had a few people, younger athletes, that I have taking time off, and telling an athlete to take time off is not an easy thing. But I always tell them the same thing. You're trading the next 3 weeks for the longevity of your career, because if you don't do this, you're likely going to get worse. And you might get to a point where someone one day is going to say, you can't play at all anymore. And if you can take a little bit of time off to prevent that conversation, well, I always talk about with people the realm of possibilities that you don't know. Right. And that's an important thing, that when it comes to a lot of these things, I have that perspective because of how many different people I've seen. And so I can tell people what the realm of their possibilities is if they don't do something. And I have that conversation a lot. So, understand that there are limitations to your body too, and you need to sometimes either rest the right way or be active the right way in the case of prehabilitation and rehabilitation. But it's about working with a professional that can make those appropriate recommendations, right? So that you're not playing a guessing game on when you think you should rest and when you think you should be overly active. Let someone dictate that.
There's also the healthcare angle. I know that sticks in your craw and mine as well. Someone, like you said, who doesn't take care of themselves before, after the surgery, and all of a sudden a 5-year hip replacement that should have been a 15-year replacement gets replaced 5 years later. And, as a taxpayer, that costs everybody money.
Yeah, that's a whole different conversation, right?
Take care of yourself.
Yeah,
man.
We can have that conversation for a million different items. But yeah, we do have to do a better job of taking care of ourselves as a population, especially with a publicly funded system. Yes, I agree with that.
You want to contact now that we're done till next weekend? 1-855-55 Lou, DRLOU is the way to go. Info@paincarecanada.com. We'll see you next time here at Dr. Payne Show, Global News Radio.